You're with Virginia on ABC Radio Melbourne.
Whenever we come across well-credentialed, fascinating people here in Victoria, we immediately book them in for a bit of a chat. And when we came across the name of Dr. Angela dos Santos, Australia's first neurologist of Aboriginal heritage, working at a stroke physician at Alfred Health and the Royal Melbourne Hospital, we immediately decided we wanted to have a conversation with her. She recently joined Ambulance Victoria Stroke Telemedicine service as a consultant. And she joins you now. Dr. Dos Santos, good morning and good to meet you.
Nice. Good morning, Virginia. Nice to chat and thanks for having me.
How did you get into neurology?
That's a story that essentially traces back to my intern year working at Westmead Hospital, when a patient of approximately 45 years of age had presented with an acute stroke. She was unable to move one entire side of her body, and within minutes of giving her the clot-busting drug called thrombolysis, we were able to fully reverse her symptoms. After that, I felt like a superstar, a doctor's superstar. You know, it was just a fantastic outcome for this woman, and I just thought I just want to hopefully be able to continue to do this throughout my career.
Tell us about Ambulance Victoria's Victoria Stroke Telemedicine service, because we've all seen the stroke vans that go, roaring around town with the acronym on the side. But is there now a phone line that we can call for immediate service?
So how it works essentially is when you're having a stroke and you present to your regional hospitals, so regional hospitals within Victoria. Essentially, they are able to set up then a telecommunication system which allows the patient to be examined by a neurologist who is sitting within an area in Melbourne city centre or wherever they happen to live, so they're usually at home. And essentially they can then video with the patient and examine them, and then also be able to review their images that have been done in their local hospital. And so when that occurs simultaneously, then very fast, rapid decisions can be made about treatment, and then hopefully that patient can be treated in a very timely fashion, because the most important thing with stroke is being able to be treated as soon as possible, because every sort of minute that you're not treated, ongoing damage is occurring in the brain. So it's important to present to hospital as quickly as possible and be able to get treated as quickly as possible. So I guess that allows expert consultation in a very timely fashion for these regional hospitals that may not have a stroke neurologist on site.
That's brilliant. And so you can consult down the line and get those critical clot-busting drugs into them. How much faster?
Oh, by hours and hours. I mean, if you're, say, for example, in Ballarat and you don't have a person who's experienced within stroke, they might then have to wait for a radiologist to interpret the scans, which obviously being a stroke neurologist, we're highly trained at being able to interpret those stroke scans. So you don't have to wait for the radiologist. I can look at the scans immediately and we can treat immediately. So this is all happening in less than sort of 20 minutes of that patient arriving into hospital, which is, the kind of the gold standard should be in under 30 minutes of a patient sort of presenting to hospital, they should be treated. So if you had then had to wait for the radiologist to interpret the scans, then they then consult the emergency doctor who then is able to treat the patient. I mean, that's delays of minutes to hours.
That's amazing. And is the system working? Do all of these hospitals, large, small and regional, are they aware that your service exists?
Oh,
and do they get onto you as soon as possible?
Yeah, certainly. I mean, I think May was one of our busiest months. 325 patients were called through to the VST service. I mean, I think that it's thankfully, most of this time the system works absolutely perfectly. There might be 1 or 2 days where the video drops out, but then you can quickly make a phone call, so it's not an issue. We always are able to review the images, which is the most important part when being able to make decisions. And I think it's more than it becomes more than just a stroke service. It becomes a very precise neurological consultation service when you're able to assess the patient via video, discuss the symptoms with the consulting doctor on the floor, and then also have nice conversations with the family around the bed, because obviously the family are able to see you and talk with you as well, so you're able to explain the situation in a comfortable scenario in the hospital, and answer any questions that family members might have.
Tell us about where you come from. You come from Nambucca Heads, is that right?
Yeah, Nambucca Heads, nice coastal town. It's now known as Nambucca Heads. It is Gumbaynggirr country, which is where I grew up, and my family is also from Queamble country, which is northern New South Wales, up near Ashford. So I grew up there until I was 17, and then I moved to Sydney to do medicine.
And it was always to improve health outcomes for Indigenous Australians that you went into medicine, I understand, Angela.
Yeah, definitely. I mean, we're a very small population in Australia. Only 3.5% of Australians are Aboriginal and Torres Strait Islander, but we sometimes see some very alarming statistics about that relate to the poor health outcomes of Aboriginal people and Torres Strait Islander people. And I think it's really important that Aboriginal doctors are able and empowered and are able to get through to important positions such as doctors to be able to try and help improve those outcomes and absolutely change the narrative.
Well, I think the story that you're telling us about that new telehealth approach is really quite brilliant. I'm glad to know about it, and I guess it just gives you a greater sense of assurance that if that happens to you or someone you know and love and you're not in a big city hospital, there's still a networked service that can work for you.
Yeah, exactly right. I mean, and I just hope that it continues on. I mean, I'm sure that you're aware that with COVID-19 there's been a lot of telehealth rolled out, which has been fantastic. I just hope that it's able to stay around because it really does make a huge difference. I think it's important that people can access specialist care regardless of where they live in Australia, not just in Victoria. Some small regional communities or rural and remote Aboriginal communities, I mean, they should get access to specialist care just as much as anybody else living in a city, as you said. So, I mean, I think it's really important that telehealth continues to be something that we really try to push for and prioritise going forward, making sure that there's infrastructure in those smaller communities to be able to support the telehealth scenario is vital, I think, in improving health outcomes.
We've all seen that in so many different ways. It's been one of the very few silver linings of COVID-19.
Yeah.
Dr. Dos Santos, really good to talk to you. Thanks for your time.
Thanks for your time. Okay, bye.
Dr. Angela Dos Santos, Australia's first neurologist of Aboriginal heritage. And if you were feeling perhaps a little worried about, those who might be stroke risk out in smaller areas with little and regional and understaffed hospitals, there is that nationwide service, the stroke telemedicine service that will be deployed by that hospital, which is great news.